Hey everyone, it's Dr. Charlotte Hodges, and I am just about to go get my roots done. But before I do, I wanted to do a quick little video on a really common question that I get, and it's all about pregnancy and weight loss surgery. What are the risks? When can you get pregnant? What's the deal? So let's hop right into it. So I certainly have my own personal thoughts on this, just with the different experiences that I've had with my patients. I also have a very good friend, Dr. Beverly Reed, who is a fertility specialist, and she sends a lot of patients my way in an effort to help them get pregnant. Whether they're doing medical weight loss or surgical weight loss, they certainly can have much better outcomes whenever they get to a more normal BMI. They just respond much, much better to the medication. And oftentimes, if the ladies are even in their 20s and they've been having an issue with getting pregnant, just getting the weight off allows them to get pregnant without even the use of any medications. So, but I do think that this is a very timely topic, as I often get questions about pregnancy and weight loss surgery. And so one of the things that I did is last year in the spring, actually right before COVID hit, I was able to go to the TABS meeting. That's our Texas Association for Bariatric Surgery. That's our state society. And they had some research that was presented that actually showed some safety with getting pregnant within 12 months of having surgery. However, when I looked at some of the data, just so that you'll have the official word, and I was looking at the NIH, also the statement from ASMBS, which is our National Bariatric Society, as well as ACOG, which is the National Obese Society. The official word is, if you have weight loss surgery, they recommend that you wait anywhere from 18 to 24 months, with the thought being mainly that they want you to get to a nice, good, healthy weight, number one. But then number two, they will also want to make sure that your nutrition has been optimized. Now, when I did go and do a little research, though, there's a really good article, and I'll make sure that I get this, a link to this article added to this. But there were several studies that actually looked at outcomes on pregnancies, either that when pregnancies were conceived early, meaning within 12 months after surgery, or late, meaning after 12 to 18 months after surgery. And what they found was that these surgeries did not find any significant differences in perinatal outcomes between the two time periods. And so the largest of these studies determined that high blood pressure, diabetes, or bariatric complications were not different between the two groups. And also neonatal outcomes such as birth malformations and mean birth weight, there was no difference. So I know that there have been definitely some studies and some concerns out there that after weight loss surgery, there's a risk for low birth weight babies, for early pregnancy. But there was some much larger studies that have shown that if the mother, if her nutrition is optimized, there really isn't a significant difference. Interestingly enough, they did also note, though, that a small percentage of early pregnancies occurred after infertility treatments, suggesting that clinicians who manage infertility in these patients do not need to wait 12 months until attempting conception. So I know that for the majority of OBs that are out there, they will recommend that their patients wait 18 to 24 months. However, you may find a fertility specialist, and while I do not want to give any medical advice over the internet, I will say I am a bit more aggressive, knowing that we do have a lot of research that shows that the risk for complications during pregnancy and with your baby's outcomes, should you get pregnant within 12 months of having surgery, the research is finding out that there is not as much of a risk as previously thought. Now, again, the official statement is wait 18 to 24 months. However, I do know whenever I have some ladies that will come to see me and they're planning to start a family. Maybe they've been having a very difficult time getting pregnant, and especially if they're over the age of 35 and they're about to undergo some IVF treatments and they need to lose weight, I will recommend that they be a bit more aggressive, provided that their OB and their fertility specialist feels comfortable. So a lot of times it will have to do with the physician that actually is going to be taking care of you. But I mean, I've certainly had a lot of patients have surgery, and with 3 or 4 months after having their surgery, they come in and they're like, guess what? I'm pregnant. I didn't mean to get pregnant, but here I am. And I guess what's nice for me to be able to tell them is, provided that they keep up with their bariatric nutrition, for the most part, they should have a nice, normal, healthy pregnancy. Now, with that said, it is very important during your pregnancy, whenever after you've had weight loss surgery, that you keep up with your bariatric vitamins and your protein supplementation. You most certainly are going to be at risk for a low birth weight baby should you not keep up with your protein. I've had several patients that have undergone a duodenal switch, which is of course the most aggressive of the surgeries. They came to me 6 or 7 months pregnant. They hadn't had surgery with me originally, but they were able to find me, because I will take care of patients that have had surgery with other doctors, and their babies have been low birth weight, but it's only because they just haven't kept up with their bariatric nutrition. I think it's also very important that not just during your pregnancy, but if you're also wanting to breastfeed or pump. All I did was pump. I pumped for 9 months. The baby doesn't, I mean, yes, it's good to do skin to skin and all that good stuff, but the main thing is that if they can get as much of that breast milk as possible, so they can get your really good antibodies. So, but it is really important if you're going to be breastfeeding or pumping, that you also keep up with your bariatric nutrition so that you can produce enough milk. And so what does that mean? If you are a sleeve or a bypass, make sure you're aiming for 60 to 80 grams of protein a day. If you are a duodenal switch patient, or if you're getting a long limb bypass, then you most certainly need to be aiming to 100 to 120 grams a day. I would most certainly err on the side of higher of those two numbers. That way you can make sure that you're getting proper nutrition as well as your baby. Also, it's really important that you're taking a good bariatric formulated multivitamin. You're keeping up with your folate for your baby's brain and spinal cord health. You keep up with your calcium, B12, and vitamin D as well as iron. It's not uncommon for ladies that are pregnant to become a little iron deficient. You know, I do think one of the benefits of having weight loss surgery and then trying to get pregnant is, number one, you really should have a much healthier pregnancy now that you are at a much healthier weight. And the other thought is that, let's say you had diabetes prior to surgery, or you had high blood pressure. Well, if those things can be controlled and put into remission prior to your pregnancy, well then all the better. So, like I said, I'll make sure that I add this link. I hope that this has been helpful. You know, again, the official stance is, if you want to start a family, you should wait about 18 to 24 months. That's the official stance from the Bariatric Society and from the OB Society. However, we do have much more research that is coming out that patients can have a good, healthy pregnancy, even should they get pregnant within 12 months of having surgery. So hope this helps. Make sure you keep up with your bariatric nutrition. And if you want to get on that baby train, let's get on it. Okay? Bye-bye.